Your cat is licking your hand right now, purring, looking perfectly healthy, and you have no idea that inside that adorable little mouth, something could already be going wrong. Most owners never find out until a vet points at an x-ray and says the words nobody wants to hear. This could have been prevented. By age 3, the vast majority of cats already have some form of dental disease. And the scary part is that cats are experts at hiding pain. In the wild, an animal that shows weakness gets targeted. So evolution taught cats to mask discomfort completely, which means your cat could be in real pain right now, while still eating, playing, and sleeping on your lap without giving you a single obvious clue. But there are 3 signs vets say almost every owner completely misses. And once you know them, you will never look at your cat's mouth the same way again. Sign 1 hides in something you probably smell every single day and dismiss as completely normal bad breath. Owners often laugh it off. Cat breath is just cat breath, right? Wrong. Healthy cat breath should be mild, almost neutral, barely noticeable when your cat yawns near your face. If your cat's breath smells sharp, sour, almost metallic, that odor is not just an unpleasant quirk. It is often bacteria actively breaking down along the gum line, slowly working its way deeper toward the bloodstream with every single day it goes unnoticed. This is not just a smell problem sitting on the surface. It is an early warning system your cat's own body is quietly sending you, and most people walk right past it every single day without ever giving it a second thought, blaming it on food, on age, or simply on cats being cats. Think about how often you actually smell your cat's breath on purpose. Almost never, right? Most owners only notice it by accident during a random cuddle or a yawn a little too close to their face. And even then, they brush it off in half a second. But bad breath in cats is rarely just bad breath the way it can be in humans after a strong meal. In cats, that odor is very often a direct signal of bacterial buildup along the gum line, the exact spot where plaque first begins forming and hardening into tartar. The stronger and more persistent that smell becomes, the more likely it is that inflammation is already actively happening beneath the surface, invisible to the eye, but very real to the nose if you actually pay attention to it on purpose instead of by accident. Here is a simple way to actually check this properly instead of guessing. Once a week, gently hold your cat's face and exhale test style. Get close enough to smell the breath directly rather than relying on random moments. Compare it in your memory to how it smelled a month ago. A gradual shift toward sharper, more sour, or more chemical-smelling breath is the kind of subtle change that is incredibly easy to miss unless you are actively comparing week to week, but incredibly valuable once you start tracking it consistently, because it often shows up weeks or even months before any other visible symptom does, giving you a genuine head start on catching the problem early. Tracking this over time turns a vague suspicion into real evidence you can bring straight to your vet. Instead of saying it just seems a bit off lately, you can describe exactly when the smell changed and how it has progressed week by week, which helps your vet catch the problem earlier and treat it faster, often before it ever reaches the more painful and expensive stages that so many owners only discover far too late. Sign 2 shows up during mealtime, and it is incredibly easy to blame on pickiness instead of pain. Watch closely the next time you feed your cat instead of walking away while it eats. Does it turn its head to chew only on one side of its mouth? Does it drop kibble halfway to its mouth for no clear reason? Does it approach the bowl eagerly at first and then suddenly back away after just a bite or two, almost like it changed its mind. Many owners assume their cat simply does not like the food anymore, so they switch brands again and again, spending money on food after food after food, when the real problem was never the food at all. It was pain. Every single time their teeth made contact with something even slightly hard or crunchy. A cat quietly avoiding one side of its mouth is often telling you exactly where the problem is hiding, if you are actually paying attention instead of just refilling the bowl on autopilot. Some cats will start preferring wet food over dry seemingly out of nowhere, and owners often chalk this up to changing taste or getting picky with age, when in reality, softer food simply hurts less to chew. Others might approach their bowl slower than usual, sniff the food longer before eating, or eat in shorter bursts with pauses in between instead of finishing a meal in one confident go the way they used to just weeks earlier. Key here is comparison over time, not a single meal in isolation. Watch how your cat eats this week and actually remember it. Then compare that same behavior a week later. A one-time hesitation might mean nothing at all. Maybe the food was slightly different, or your cat simply was not that hungry. But a consistent pattern of one-sided chewing, dropped food, or growing hesitation at the bowl over several days in a row is rarely a coincidence. It is very often your cat's way of quietly telling you that something inside its mouth hurts every single time it tries to eat, normally like it used to. It also helps to actually film your cat eating on your phone every couple of weeks. Just a short 10-second clip during a normal meal. Slowed down footage often reveals things live observation misses entirely. A slight head tilt, favored side, a brief pause before certain bites. Comparing these short clips side by side over a month can reveal a gradual shift long before it becomes obvious in real time, giving you concrete evidence to show your vet instead of a vague feeling that something seems slightly off with how your cat has been eating lately. Sign 3 is the one most owners literally touch without ever realizing what they are actually feeling. Gently lift your cat's lips